Yes, hello everyone, and it's great to see that some of you are already introducing yourselves in the chat. It's great if you just introduce yourselves, your name, which organisation you're from, and where you're joining us from in the world as well. That's really useful information for us, and nice to get to know each other a little bit in this short session that we've got today. So hopefully if you're here, then you are interested in learning more about the DISARM project and our aims to work together for livestock health and ultimately reduction in antimicrobial resistance. I'm Laura Palczynski, and Annick Svans from ZLTO is also joining me today, and we will be presenting first of all a little bit about the DISARM project. Then I'll hand over to Annick to explain a little bit about what we're doing in terms of our farm health teams and using the multi-actor approach. So basically, first of all, the DISARM project, and as I said, please do introduce yourselves in the chat. We are a consortium of 17 partners. I haven't counted us in a while. As shown on this slide, we're coordinated by Ilvo in Belgium, and lots of different partners from research organisations and farmer-facing organisations to work together on this project. The aim of DISARM is to reduce antibiotic resistance by reducing the need for antibiotics in livestock farming through a focus on disease prevention and protecting animal health. So how are we aiming to do that? Well, we are a Horizon 2020 thematic network project, which means that we're aiming to work with a multi-actor community. So that's farmers, researchers, industry, and vets and other advisors as well. To bring everyone together and share cost-effective and beneficial strategies that can improve animal health, reduce antibiotic treatments, and also ultimately reduce antibiotic resistance. And we're primarily working in the areas of pigs, sheep, cattle, and poultry. So how do we go about working with this? Well, we are developing lots of strategic communication and dissemination materials, from short summary abstracts, informational videos, best practice guides are in development at the moment, and we are also producing web and social media content based on this information, and reports as well. And we are also hoping to, with COVID restrictions easing, to do more in the way of cross-border exchange and events and workshops in person. But for the time being, we have been doing a number of events online, like this one. In order to produce those, we have a couple of different work packages. So the first one is the state of the art, where we've basically done a bit of a review of what's available in research, industry, and practical on-farm innovations as well, of what's available, and we are summarising that in a report currently. We've also got our community of practice, which if you aren't already a member on Facebook, please do look us up, join us. If you answer the questions, then our admins will be able to admit you no problem. If you have tried to join and you haven't been accepted yet, just do check that you've answered the questions that you need to. If you're not a Facebook user, that's fine. We are on we are on Twitter and LinkedIn as well. We've also got our website and other ways to contact us. You can contact partners directly. You can use info@disarmproject.eu as well. There's a range of different ways to get in contact and contribute to this community that we're building. And then our final area, which at this point I can hand over to Annick, is our multi-actor farm health plans, which is a series of case studies which are testing collaborative working between multi-actor teams to develop farm plans to help animal health and reduce antibiotic use. So, Annick, over to you.
Yes, hello everyone. My name is Annick Spaans. I'm from the Netherlands, working for ZLTO, a farmers association. And I'm involved in the DISARM project, mainly with communication activities, as well as the practical implementation of the project in the field, which is about farm animal health teams for healthy livestock farming and prudent use of antibiotics. And we are using over there a multi-actor farm health approach. And I will tell you something more about this during the next few minutes. I will start with this picture, as this clearly illustrates the farm-specific action plan we are working on in DISARM. You see the farmer, the feed advisor, and the veterinarian together at the table with a coach or a facilitator working on a farm-specific action plan. And you see that it is real teamwork, and they are working on a specific action plan in order to improve the animal health and to reduce the use of antimicrobials. And you can think about various types of actions. So think about improving the biosecurity, feed management, water quality, changing genetics, and so on. So it's very diverse and very farm specific. But in the end, it is all about teamwork, having the farmer, the feed advisor, and the veterinarian together with the aid of a coach. The coach is guiding the process while the feed advisor and the veterinarian are giving their knowledge and expertise. And together with the practical knowledge of the farmer, the farmer is making the final decisions about this action plan. And together they are implementing it and striving for a better animal health and a reduction in antimicrobial use. So why are we promoting this approach? We believe that reducing the need for antimicrobial use is more than just cutting its use, because it's a very complex thing. It requires a knowledge-intensive process and rethinking farm-specific management practices and farm organization. But it's also something in their minds. So we need to break routines and change behavior and change perceptions and presumptions. And that's also why we think that coaching is an essential thing in this approach, as coaching helps a team in making changes into the desired direction in a desirable manner, as it brings out the potential to improve performance and to change perception and it builds awareness. And the coach can also help in motivating their choices and leading to a change. They can guide the people to stimulate, to talk, and to say something what they want. Well, in DISARM, we are currently busy with the farm animal health teams for a while, and there are some advantages we experience. We see that different sources of knowledge of the farmer, veterinarian, and the feed advisor together at one time works very efficient. And there is a synergy in team discussion that has added value over the individual consultations. You often see that the farmer has an appointment with the feed advisor and they are pointing to health issues of the veterinarian, or the other way around. If there is a challenge discussed with the veterinarian, they're pointing to the feed. But by having the team at one place together with a coach, it is seen that it's real teamwork and they're having shared ownership and motivation to actually do something and start working on their goals and action. So they have support from the other team members, especially for the farmers, in making the change. And the big advantage of having the coach inside this process is that there's a really structured process in a tailor-made action plan. So within DISARM, we have currently 42 farm health teams in Europe. And you can see at the bottom of this slide the different countries and the different sectors we are working with. And within this farm health teams, we are using the input of DISARM. Like Laura already told you, we have the community of practice, the state of the art, and we are also collecting best practice examples, such as we are making videos, practice abstracts, and we are also organizing events. And that's also why we are asking your input in order to share it to our farm health teams and beyond, of course. But it also works the other way around. We want to share our approach at the farm health teams to everyone. And we are doing it by giving workshops about the farm health approach. And we are currently developing an online farm health toolbox. And we'll also develop video testimonies and case study reports. So if we go a bit more in detail about how this approach actually works, you see over here an arrow with the plan, do, check, act, and that's the key element in this approach. But we always start with the farm intake. So we will visit the farm and have a short interview about the main health challenges, collecting some technical results, and think about the collection of the context of the feed advisor and the veterinarian. Then we set our first meeting to set the diagnosis together with the veterinarian, the advisor and the farmer, together with the coach, in order to develop an action plan. So this is the plan phase. And then the responsible persons need to implement the action plan. So that's the do phase. And then after a while, there's a follow-up meeting in which the action will be evaluated. And if needed, there will be an action followed on it. So it could be an adjusted action or a new action. And this cycle continuously follows up. And after a while, we have the last meeting in which the process will be evaluated. Next to this process, we also have a knowledge exchange for the farmers in which they can learn from each other. We will have a national exchange as well as an international exchange. But of course, due to the Corona crisis, we still need to see how we can organize it. But of course, we have digital alternatives. Then if we look a step more closer, I want to go to the stepwise approach of the plan, do, check, act circle. I already showed to you in a previous slide. And step one we always do is observe and define. And then we start with the inner circle to think about the key element of the challenge they want to reach in the farm. So what's it about? And well, in DISARM, it's quite obvious about reducing the use of antimicrobial. And different teams are related to this. Think about the vaccination protocol, genetics, biosecurity, feed, and so on. But you cannot start with doing all teams at one time, because then it will be a chaos and it isn't structured at all. So you need to prioritize the themes and think about what is the most important thing to focus on right now. You need to define that team and make a goal of it and make it smart. Then we are going to step 2, which reflects again the plan, do, check, act method, in which in the left part you see the SMART goal again, which stands for specific, measurable, acceptable, realistic, and time specific. So that means that if you are creating a goal, all the SMART elements needs to be included in it. So it will be a very detailed goal in which, for example, a measurable element is in, such as a percentage or a number, and it will be time specific. So within 3 months, a certain activity is reached, and of course, it will be very detailed. Then you go to the implementation phase, the do phase. So who is doing what, when, and why. And after a while, after the time element of the SMART goal is reached, you're going to evaluate it. And yeah, you can see who is the project owner, who is the project solver, as it can differ. The project owner can be the farmer, while the employee needs to execute it, for example. And while evaluating it, you can see that sometimes a goal needs to be adjusted, or a follow-up goal is coming from it, and that's the act phase. And if you have adjusted your goal, you have already a new SMART goal, and then the cycle starts again. So in that way, you're continuously busy with plan, do, check, act circles and improving your goal in order to come closer to your final goal of the reduction of your antimicrobial use. So here you see it a bit more in detail. The definitions of the SMART goal, so specific, measurable, acceptable, realistic, and time specific. The do part, who is doing what, when, and why. Then the check step, evaluation in a nice table, followed by the acts. So if needed, there will be some adjustments to the goal or some follow-up actions. I always end this stepwise approach with step 3, keep the scale in balance, as it clearly reflects the mission of the reduction of the antibiotic use, in which the whole team is responsible. So the farmer, the veterinarian, and the feed advisor, of course, with the help of the coach. But you see over here that there are different plan, do, check, act circles that needs to keep in balance by the mission. So I started with that you need to prioritize your plan, do, check, act circles and to choose one. But on the other hand, you do not need to forget the other ones as you focus on the biosecurity, for example. While your vaccination schedule is very bad, then you won't reach your final goal, final mission. So in that way, we are trying to keep focus on all of the integrality of your farm, but try to keep the focus on one thing at the time. So this is the approach we are using in DISARM. I have some take-home messages from it. Well, of course, unfortunately, during Corona, our progress isn't that far yet as hoped. So we haven't got some real results about the reduction of antibiotics, but we do see some promising results in the improvement of general farm animal health, as well in the improvement of biosecurity and disease prevention. And it's also promising to reduce the needs for antibiotics in livestock farming. And we do see as well some interesting changes in the mindset and in the perception of the participants, of the team members of the DISARM farm health teams. And its powers lies in the synergy between knowledge and expertise. And there's a coherent advice as they are all together. And next to that, coaching and supporting of the farmer is necessary to make changes. That's also something we are experiencing. So that's the part of the farm health teams. And now I want to give the floor back to Laura.
Great, thank you, Annick. Yes, so basically back to the point of why we invited you all here today. We need you. We can't have a multi-actor approach to sharing all of these ideas and ways to improve health on animal health on farms if we're missing key experts and people who are working day to day with animals on the ground. So we want to share your knowledge through the DISARM network on our channels. And you can do this by joining the DISARM community of practice on Facebook. And as I said earlier, if you're not on Facebook, we're also on Twitter, LinkedIn. We've got our website, and you can email us as well or contact individual partners. There's a range of ways to get in touch with us and tell us about exciting things that you're working on. Also, we are working to develop some short videos. In the short term, if you're quick, we might be able to feature some of your work or your practices in those. Do get in touch if you've got ideas for that. And we'll also be planning more and more events and workshops, both digitally and hopefully in person as COVID restrictions ease. So those are some ways that you can get involved in us, and we'd love to publicize your work. And obviously, also if you share the information coming from DISARM, we can further these networks and improve networking between different actors you might not know about currently, but would really complement your work. So do keep an eye out for how you can meet new people and find out about new projects and bits of work that you might not have been aware of before. And so that's it for us. We'd love to open the floor for if any of you have any questions or want to take this opportunity already to talk to us about what you're working on. We'd love to hear from you. So I see we've got a question in the chat from Juliana, working for a North American startup leveraging the microbiome of dairy cows to create products that reduce antibiotic use, and how can we get involved? Well, as I said, that sounds like a perfect thing. You can share case studies, examples, and things like that, proof of your concept and all of this on our community of practice, or get in touch directly via email. So Annick, I think this is probably a question for you. Caroline from Animal Health Care Flanders in Belgium asks, could the herd veterinarian be the coach, or do you recommend someone else, an independent person, to do that role?
Yes, thank you, Caroline, for this question. I think during DISARM we experienced that being an independent person really helps the process, guiding it further. And as the veterinarian has also a very important role in giving their expertise and setting the goals. And if the veterinarian also should be the coach or the facilitator in the process, they need to have a double role in it. So they cannot fully focus on giving their expertise of it. So that's why we experience to have an independent person on it works better than having a veterinarian with doing both roles. I see a comment of Julia that she hopes to expand to other continents soon, and I think, of course, we are hoping that, and we are willing to share our knowledge to other continents outside Europe as well. So feel free to contact us to think about some webinars, or maybe in person would be also nice, but let's see what's feasible. But we are willing to think about that as well.
Is there a website where farmers that engage can find a group of other farmers that are also in antibiotic reduction programs? This will help to keep them motivated. I'm not aware of any. That there might be some national organisations or groups that might work towards that, but I'm not aware of any. I don't know whether anyone else is. Annick, do you know of any?
No, I don't know any, but I am thinking about the community of practice, although it is accessible for all stakeholders that are interested in it. But of course, farmers are welcome to join, and we are sharing a lot of interesting knowledge about antibiotic reduction over there. And there you can discuss over there with all stakeholders.
We've also got Iona, a PhD student in Edinburgh. So how did we come up with the name DISARM? The idea of fighting AMR can often simplify the problem, but you seem to be taking a very holistic approach. Well, Annick and I weren't really involved in the project proposal stage, unfortunately, but we do like a good acronym in the European projects, I know that. Yeah, the individual component parts of DISARM being that we are disseminating innovative solutions for antibiotic resistance management. That just happens to make a nice word that makes sense. Was quite an attractive option, I'm assuming.
No, I do think like DISARM, it's about the long sentence, like Laura said, like disseminating innovative solutions for antibiotic resistance management. It's not per se about fighting AMR, but it's just more about innovative solutions and knowledge exchange.
Yeah, indeed. It's the acronym DISARM. Of course, DISARM is also a word that exists, which is nice, so that it's easy to pronounce, etc. But the word itself is not necessarily meant to reflect the way we look at managing antimicrobial or antibiotic resistance, or about fighting antimicrobial resistance. And indeed, the idea is a bit, of course, in this project, we mainly disseminate towards farmers and then other stakeholders, maybe not at the higher political level in terms of regulations, etc. But indeed, even at that farm level, the idea is to be holistic or systemic, and look at the different aspects of a farm that need improvement, rather than trying to rely on like a single bullet or silver bullet solution that needs to be implemented on every farm. Maybe regarding the previous question in the chat, I do believe that some people in the DISARM network are aware of maybe not websites, but things like WhatsApp groups where farmers interact, not necessarily exclusively on antimicrobial reduction programs, but on all things agriculture, if I'm not mistaken. So there are some groups. Apparently, it's also country dependent on whether farmers, for instance, form groups on Facebook or rather on Twitter or rather on WhatsApp. That depends a bit from country to country. And indeed, everyone is invited to the community of practice, the Facebook group we have. And in DISARM, our idea is also to organize, but then physical get-togethers, physical networking between farmers that are within one country, but also between farmers in different countries that are involved in these antimicrobial reduction programs through coaching and the multi-actor farm health approach. But of course, COVID-19 is for the moment hampering the extent to which you can organize physical get-together meetings. I think websites are a good alternative, or at least platforms using maybe existing social media, but often there is quite some benefit in having really physical interaction to the extent that it is possible as well.
Great, thank you, Erwin. And for those of you who don't know, Erwin is our project coordinator at ILVO. So it's really good to have you here to respond to some of these questions. So some more questions in the chat. Xavier says, do you have specific classification for antibiotic use reduction solutions? So many different and complementary approaches.
But indeed, I think there is the community of practice is organized. So the Facebook group where you can interact, share your own knowledge, or find knowledge from the projects or from others. That is organized around several teams, classes maybe, or types of antibiotic use reduction solutions, like internal biosecurity, external biosecurity, and all these things. On the websites, actually, many of our material can be found in different ways, starting from the species, pork, poultry, etc., but also starting from the type of solution. I mean, I think in general, a lot of the solutions that we disseminate and that we network about are for the moment about preventive solutions, and then prevention of animal disease problems in other ways than using antimicrobials as a preventive strategy. There is quite a lot also about early monitoring, also related to the precision farming boom, if I can say. So early monitoring of diseases, so you can intervene as early as possible, so that you can avoid having to use curative solutions for which there are not always good or effective alternatives available. Whereas for the preventive use of antimicrobials, there are actually many solutions available. And I do like the word that Xavier is using, complementary. It's indeed about complementary approaches, individual solutions that strengthen each other. As I said, there is no silver bullet solution. And we do know from research that many individual solutions like probiotics or other feed additives or nutritional strategies, they do work best if also at the same time internal, external biosecurity, housing, feed is at a high quality. And as a complementary approach, then they work, which is also related to the systemic holistic approach from one of the previous questions.
Yeah, great, thanks, Erwin. Caroline asks, is the complete farm animal health team sitting together every time they meet, and how often do those meetings happen, would you advise?
Yes, I will respond to this question. Within this DISARM, this approach is actually quite flexible within the countries. Of course, this flexibility is also needed because of the COVID-19 situation, but we also are very curious about how the differences in approach will affect the final result. But we are striving for having like a process of about 1.5 to 2 years, and within these years we will have like about 3 to 4 meetings, so to say. But you see, for example, in some countries, they have quite often some phone calls in between with only the individual farmer, or sometimes they are calling the veterinarian. If I speak for the situation in the Netherlands, we are trying to have the team meetings once in 3 months. And in between, we do not have that often individual meetings. But I think the key element in this is that it's very important to keep contact. And if that is digital or physical, well, of course, I think physical, it's the most efficient and effective way. But we also do experience that doing it in a digital way, it also helps in making steps in the process. So that's a bit how we experience it, and well, trying to be in contact as most as possible with the whole team is an important thing in this process.
Maybe I can respond to Chiara, unless Laura or Annick, you want to. So Chiara's question, so they contribute to certify milk production without the use of antibiotics. But it took 5 years to get on the markets. And the main question is, in our experience, what are limits in spreading the approach? And I think one thing, I mean, in general, I don't know if the question actually refers to spreading the multi-actor farm health and coaching approach, but in general, I think what you need in a country at the to start with is a critical mass of people, stakeholders that regularly discuss, that are aware of the need to improve the prudency of antimicrobial use, that are aware of problems. So really a critical mass of stakeholders that are involved in it, that are really also mentally involved in it, combined with a strong veterinary public health sector that also monitors antimicrobial use, ideally could also monitor antimicrobial resistance on farms. And we do see in the whole of Europe, you also point to that. I mean, sometimes it's said that Europe is one of the better continents in terms of having reduced antimicrobial use, but there is still a large difference between member states. And we do see that member states that have already been able to reduce quite a lot, or those that were the first to have this critical mass of people and this strong veterinary public health sector implemented. So that's the first thing you need. I mean, and without that, many of the other things you would want to do won't work. And with DISARM, especially with the networking part of DISARM, it's also one of the things to which we aim to contribute. And then with regards to the specific approach, multi-actor farm health teams and coaching, but maybe again, Annick can add some experiences from how they are doing this coaching at ZLTO. But according to me, the biggest bottleneck there is kind of business model. I mean, we are doing this, we are piloting this sponsored, basically funded by the European Commission in DISARM. There have been earlier projects where project money paid for the coach. But of course, if there is no projects, someone needs to pay that coach for his or her time and also experience in motivating and linking up different stakeholders or actors in the multi-actor farm health team. So turning that into a viable business model is, I think, and then the business model, whoever needs to pay, I don't know. But I know, Annick, that at ZLTO, you're actually using that coaching approach also for other issues beyond antimicrobial use.
Yes, yeah. At the one hand, we do experience that issue. On the other hand, once the farmers and the teams are working on it, you see the progress, and then you can see that the effort the team is making pays out. So I think it's more like a change of mindset and becoming aware of the approach, because the veterinarian and the feed advisor always need to be present at the farm. So if they have an appointment individually or at the same time, well, that doesn't matter. And having the coach has that much value that it pays out in the end. But I think that's still a difficult thing to see, and it also really depends on well, on the level of the farm, how much improvements they will make and how long it will take. And it's really difficult to see that effect. So it's still a difficult thing. We need to discover and to research a bit further how we can communicate this effectiveness of this approach with regard to financial benefits.
Mm-hmm. So, but well, unless you cannot disclose that, but if ZLTO is sending coaches to farms, it's the farmers who pay them.
Yes, that's correct. Yeah.
Okay.
Yeah.
So. There is another question regarding water quality, but I am not the best person to reply to that.
Yeah, in terms of water point quality, it's definitely a topic that we're looking at. That's going to be a focus topic for one of our best practice guides. And it is one of the topics that's a category within the community of practice, as Evan was mentioning earlier. In terms of the 42 farms, I'm not entirely sure because I'm not involved in that work package, unfortunately.
Mm-hmm. Well, what I know, and it might to some extent also relate to the 42 farms. It, for instance, just water quality. One thing that matters is climate, and for instance, the farms or many farms in Spain, much hotter climate, find it apparently much more difficult to improve water quality and especially prevent infections in water compared to farms in Ireland. Ireland is not among the DISARM partners, which is why I said that it doesn't necessarily relate to the 42 farms in the project. But I do remember a discussion about water quality at one of our previous meetings, where also someone from Ireland was present, which does point to the fact that there is that. I mean, it's country specific, sector specific, even farm specific. But well, measures that work in Ireland don't necessarily work equally well in countries with a warmer climate, like in the south of Spain, etc.
In terms of Jose's follow-up of do we find different realities for different species, then yes, it's largely to do with the housing systems that are used to a certain extent. For example, pigs and poultry have more inline systems, and those can be flushed and add chemicals to it, whereas more extensive grazing, particularly with cattle and sheep, might struggle a bit more to cleanse the water point quality there. So there's the elements of housing systems as well. Another point, what about engaging a few more building engineers to address the diseased animal housing systems? That's a really interesting point, and I've been working on some work recently of where do you go when you're trying to design a new building? Do you go to a builder contractor who might not know about the scientific basis of having really sloped floors to improve drainage, and they might think that's a really steep slope, but if you talk to a vet who's an expert in the housing design or a specific housing design consultant, then they might be able to help with that. But that's definitely an area of concern, of all of those trade-offs of animal health is one aspect that you're considering when you're looking at building design, whether you want it to be multi-purpose or whether you want it to be cost effective, or whether you want it to be a combination of all of these things and all of those trade-offs. It's really a thing that might not get considered until animals are in that new build and it's not performing quite as you wanted it to. So definitely a key aspect of prevention there, I think.
Mm-hmm. I think that's exactly the benefit of having these multi-actor farm health teams or multi-actor farm teams, because indeed they can be about more than just the animal health aspects, is that you really have the the expertise of different experts, the building engineers, but also nutritionists, maybe even accountants, to also look at the economic side of it, the herd veterinarian, rather than having like one of these experts come first and then install something, and then another expert trying to optimize given the installed housing systems, but really address these things in a more, again, the word holistic comes back. So that's also the idea that of the multi-actor farm health teams, that you even maybe not constantly, because it's not that farms or livestock farms are constantly redesigning their housing systems, but at certain points when the moment is there, then it could be good to discuss the changes to the housing system, not just with the building engineer, but also with other experts, again, in a multi-actor farm team setting.
Absolutely. And a few more comments coming in, returning to the point about water. Water's an issue for many reasons: biosecurity, biofilms, palatability, vector for vaccines, curative treatments, through technical additives, etc. And also adds, I guess it depends on water soil type and course management practices. In countries like Ireland, where it rains a lot, water quality can also be an issue. We need to be very careful when we spread manure time of year because of runoff and things like that. So that's very good points. So yeah, also in the Healthy Livestock Project, there's evidence that hot countries like Greece and Cyprus, it's more difficult to control diseases than in France and the Netherlands.
Yeah, but yeah, the previous comment also suggested also in Ireland, which you would not consider a country with a hot climate, water quality can be an issue. So it's probably not necessarily such that problems are always bigger or more difficult, but different and require different solutions, probably. But indeed, for some aspects, it might be more difficult depending on climate.
I think that's also the beauty of the kind of cross-learning exchange that we're aiming for, is then it depends on what we're looking in relation to water quality as well, indeed. The cross-border learning is, there might be something that doesn't quite work in a different context, but could be adapted to work differently to suit these different contexts. And that's also the beauty of cross-sector learning as well, of, you know, some sectors have all in, all out systems and are quite good on biosecurity, but maybe not quite so good in other areas, and other sectors have different strengths and weaknesses to learn from each other. Even within the same country, we can find farms that have different health issues. Yeah, that's a good point. It's very farm specific. Every farm is different, which is why we need tailored farm health approaches, or even wider than just farm health, whole farm approaches with the multi-actor approach, to establish how we can approach those based on the individual experts, based on those individual contexts and needs per farm.
Yeah, what Anna just says about even within the same country, we can find farms that have different health issues. I mean, sometimes when we describe what we are doing in DISARM, we say we don't just disseminate solutions, but we also disseminate methods to come up with the best solution or combination of solutions at every individual farm, or at least for every specific situation. So we disseminate innovative solutions, but not just solutions themselves, but also a method to come up with the best solution or combination of solutions.
So hopefully you have enjoyed this webinar and found it informative. Say we can stay on until 4 o'clock as scheduled. Do keep on popping your messages in the chat if you want to, or feel free to drop out and go and get yourself a comfort break.
Yes, and of course, Laura has indicated in the chat the different ways how you can find us. we are trying to get an extension because of our delay we had because of COVID-19. But relatively soon, I think there is a whole lot of new material also again available, like practice abstracts, so short explanations of solutions, and also videos. There will be much more coming on the website. And I assume you maybe already mentioned that in the beginning, the report about the database of innovative solutions, which will be released after summer this year. So.
Absolutely, some exciting resources coming up as well, and also those best practice guides I mentioned on those 10 focus topics, including water, which has got quite a lot of attention this afternoon.
Yes, and also from my side, thank you all for your participation, and I hope it was interesting for you. And we are happy to see you on a later moment via our contacts. Twitter, Facebook, LinkedIn, or website, or community of practice. Feel free to contact us, and have a nice evening.
Thank you, Laura and Annick.
Thank you, everyone.
Thank you.